Welcome back. The World Health Organization has cleared Liberia of any new reported Ebola cases, and the number of new Ebola cases in neighboring Guinea and Sierra Leone declined a bit last week. The report, a weekly epidemiologic update today, stated that much of the disease activity centered in two capital cities for the second week in a row. Boakai Fofana is Liberia Bureau Chief All Africa Global Media, and he joins us now via Skype. Thanks for joining us, Boakai. Now, first, local advocacy groups say there are companies that have been accused of exploiting the situation in their favor. Can you take us through this development?
Well, this is just emerging, actually. It was released by a report was released by the Global Witness Group, which is actually an international campaign organization, which essentially accuses the Golden Verolium Liberia, that is a palm oil company. We signed a contract with the government in 2010 to have a palm oil plantation in Liberia. So this report essentially accuses this company of exploiting the Ebola situation. It says that when they had of the Ebola situation, the company was negotiating with locals, sort of influencing them in an adverse way to sell their land. And initially, we should state that this company has already been allocated 220,000 hectares of land in the initial deal. But the company has denied these allegations. It says that it did in fact slow down some of its operations during the height of the Ebola season, so that wasn't possible. And we should state for the record that a lot of the companies working in Liberia actually were very instrumental in helping to control the disease, Golden Verolium being one of them.
Now, according to the World Health Organization, no new cases have been reported. What is the situation like on the ground?
Yeah, we do not have any new case now at the moment as we speak. Liberia was declared Ebola-free on May 9th, and that was on May 9th. Unfortunately, we had a new case which emerged sometimes late in June. But as a result of that index case, the public health people will call it an index case, 6 other cases emerged, out of which 2 died, including the index case, and then 4 other persons were treated. 2 have already been discharged, 2 are in the hospital to be discharged. So as of now, we do not have any new case. Currently, the population is sort of optimistic that our health workers are able to control the situation. They are on top of it. The government has continuously said this time around it has the capability to control the Ebola virus. This was just an unfortunate incident. How it came to Liberia, nobody knows. Still an investigation. There are a lot of theories about one of them, in fact, stating that the guy who brought it, the 17-year-old boy that is who brought it, ate a dog, but some scientific evidence has sort of disproved that. So it is still an investigation. Currently, the population is just preparing for its independence, so we haven't worried too much about Ebola, for the independence celebration.
Boakai, what's the situation like in rural areas? Because we understand there were problems before. Is the situation improving there? Yeah,
actually, I mean, let me recall that the concentration of Ebola were actually in urban areas as opposed to rural areas, if you will recall. And that is because of obvious reason the population concentration is in Monrovia. But we should also state that the bordering counties, our bordering counties are along countries that still have Ebola occurring there. For instance, Guinea and Sierra Leone. So there are counties along those borders, that are potentially at risk. But the authorities here have started to take precaution. They've deployed not only health workers but also locals and local authorities along the borders to start investigating movement along those borders. So for now, the rural areas are calm. In fact, even the new case that just emerged happened around Monrovia, and it is still being investigated whether it actually came from neighboring countries or even other part of the rural counties.
Just finally, can you take us through some of the main challenges facing aid organizations in those countries?
Well, the challenges in Liberia are so enormous. We have a lot of, as far as healthy concern. You know, this is a post-conflict nation, so we were already struggling to build our health system from the 14 years of civil conflict. So then Ebola came and struck, and then we took a beating from Ebola. So aid organization I helped in the government, and to build our health system from a point of I would say zero. So basically it is quite a challenge. It is an enormous task. During the height of Ebola, during the early stages of Ebola, it took the help of Medicine Sans Frontières to continue to innovate. In a way, before the World Health Organization came on board, the Americans came on board, another international organization. So the challenges are so big, and everything is a priority for a country like Liberia emerging from war.
We'll have to leave it there. Thank you very much for the update, Buakai.
Thank you so much.
That was Buakai Fofana, and he's the Liberia Bureau Chief for All Africa Global Media, and he joined us via Skype from the capital Monrovia for the latest report released by health organization WHO that reports no new Ebola cases in the country.